Ladies and gentlemen, welcome back. Thank you for being with us today on We Should Know. Thank you for your comments from our show last week. Economic developer John Swope was with us, and we talked about obviously jobs and some of the developments that he has done since he's been here in the county working with getting industry and jobs to this county. This week we thought we'd change gears a bit and talk about something that may be on your mind and unfortunately could be something on your mind coming up, and that's summertime accidents, issues, and things that oftentimes happen as we're out and we're more active in the public and we're out at beaches and various other places. Nobody comes to mind anymore that's involved in these kinds of things than Richard Stevenson. Richard, you're Director of Allied Health, Emergency, Fire, Medical, Public Safety at Sampson Community College since 2002. And the duties and the things that you do there have always, of course, I worked with you for quite a few years before I retired, so some of the things I know. But what's always amazed me is oftentimes we can kind of go too far up the medical chain and get specialists, doctors and others, but really where the rubber meets the road when people first get a touch is the people you teach or the people that are out there that are paramedics and others every day on the street. I want to thank you for being with us today.
Well, thank you, sir.
Busy schedule, but I want to open and kind of talk about emergency issues as it relates to the individual, the novice, somebody like me or somebody else is just walking down the street, or maybe a child or something that happens, and talk about some of the kinds of things. The other day I was out of the county and at a location, and all of a sudden I look over and there's several people standing around, and other people have probably done this too, and you see somebody and they're either laying down or sitting down, and you go, well, what can I do? Well, you walk up and they say, well, EMS has already been notified. So, well, you know, there's not a whole lot you can do, but the first thing that crosses your mind, and I want you to speak to this, is legally, what if I do get involved, and what is the issues, and should I legally try to do anything?
Sure, that's a question that's been asked for time and time again, is what are your legal responsibilities to help if you're trained? But then what if I do? What if I'm truly that good Samaritan? And we'll allude to that in a moment. And the best answer to that is that we have legislation in place that is called the Good Samaritan Law, which in essence means that if you render first aid or assistance to someone and you do no more than what you're trained to do, what's reasonably prudent to do in that situation, then it gives you immunity from civil prosecution, because obviously when things don't turn out the right way, sometimes that is an avenue that's brought about. The neat thing about this is the Good Samaritan Law comes from an age-old story. Are you familiar with that? And it was kind of neat. It's the documentation of the first ambulance transport, the first insurance payment, and then something insurance companies will never do, which is just funny, which it goes back to the Bible, to the Good Samaritan. And if you know the story, the Samaritan, while on his journey, came across a man who was laying on the roadside who was actually beaten and robbed, and it was actually his enemy. And he felt so empathetic for him that he assisted this person, placed him on his animal and transported him to the first town. So there was your first Samaritan transport. Boy, yeah. That's right. But then when he arrived at the end, he paid the innkeeper to take care of this man, and there was your first medical payment. Mm-hmm. But then he did something that we don't do in our society, which he told the innkeeper on his return journey if there were any additional monies that he would pay them as well. You know, society got it right this time when they actually came up with legislation that said the layperson, the non-medically trained licensed person that's willing to help their fellow man, we're going to give them some protection legally to do what they were trained to do or what was reasonably prudent. And a lot of people need to know that. If you are a trained and licensed medical professional, you fall under what's called a duty to act. And that duty to act only is incurred while you're on the job. Because some people have often asked, you know, well, if I go through the training and I've got a sticker on my car that says I'm this, I'm that, and I ride by an accident scene, you know, and somebody sees it, you know, am I going to be in trouble? And it's no, because if you are a licensed professional, your duty to act is when you're actually on the clock. Now, it gets into a moral and ethical responsibility. Do I feel like I need to stop? But that is the big thing. you alluded to, the licensed healthcare personnel, but I think the focus on this show is what can the general public do? What should they do? How should they respond if there is a sick, ill, or injured individual? And I think we're going to allude to that in a few moments and actually find out how key they are in successful outcomes.
Well, and I think you're right, and you're dead on, because what I want to try to do is kind of the underlying theme for this show is education and information. So hopefully folks today will get a little bit of both of those, maybe get educated a bit and some information. But one of the things that often happens when folks observe somebody, and I want to look at it from the sense of whether it's somebody in your family, maybe a senior person in the family, it might be a child. How do you assess and determine what level, what you should do or what shouldn't you do, depending on what it is? Say the person comes in and they got their hand is swollen, and you look at it and you say, yeah, it's a lot bigger than the other hand. Right. How do you determine whether what you're dealing with, and at what point in time do you rush the person to urgent care or to a hospital?
Well, it's a good question, and the way I try to advise people is, when in doubt, rule it out, okay? How do you recognize that there's actually an emergency and you decide to help? Is, honestly, does the person look sick, ill, or injured? Do they have a chief complaint? Is there a root reason for their complaint? And then is it something that is reasonable that you can handle at the home? Or do you need to rule it out? Do you need that medical attention? I can tell you from experience with having a 2.5-year-old, there are things that I'm certainly comfortable diagnosing and treating if it was your child. Mm-hmm. But when it's mine, sometimes I want that second opinion to make sure that I'm right. You have to listen to that inner self when you're dealing with emergencies. The person who's sick, ill, or injured knows better than anyone if things are not right. That's why we are always dependent upon them. But based on their chief complaint, there's several things. Shortness of breath, chest pain, any of these things that we hear paramount in the medical community are worthy of being further investigated, because you want to make sure that your medical interventions are done early. That's a key thing, and we're going to tie a couple of things together now. One thing is that the public needs to understand how our EMS system works. And people always think, if you call 911, they're going to respond, then I got to go to the hospital, but it was nothing, or it was something. Well, the thing of it is, the EMS service actually provides on-scene assessment. And when they get there and they do the assessment, and the person feels that well, based on the information now I'm hearing from trained medical personnel, I can drive myself, or I can go see my family doctor, it's not as emergent as I thought. Kind of a panic mode reaction. And they have the right of refusal without any consequence, and then still pursue an alternate means of evaluation. But the key thing to remember is by dialing 911 and getting things checked out, you're assuring that continuity of care.
And to that point, for the most part, Sampson County, the county that we're in and we broadcast from, along with the surrounding counties that pick up this show, most of those counties fall under a paramedic level trained person. Is that correct?
That is correct.
And now just kind of explain to folks what that is, so to add to what you just said.
Sure. Paramedics are the highest level of training that pre-hospital personnel can achieve. They are very highly trained and qualified, and they serve as an extension of the emergency room physician. So when they come out and check you out, you're getting someone that has been through essentially almost a 2-year training program to achieve that, and done hundreds and hundreds of hours of clinical experience in the hospital and clinical experiences or field experiences out in the field dealing with emergency medicine. So these are highly qualified and trained personnel to do that. And the bottom line is it gives you then, more information to make that decision. Obviously if they arrive on the scene and the person consents to treatment and transportation, they're going to carry you to the closest facility and get you checked out by an emergency room physician. But if you decide that you know, well, based on the evaluation and how I feel now, perhaps I can go see my family doctor. That's an option as well, and you have the right of refusal.
Well, I think one of the things that's important for folks to know, you and I both know that history, when we look back at history, we didn't have this level of care. And we have really come a long ways. At least I can remember during the days, I may be showing my age here, which is fine, but I remember the days when the ambulance from the funeral home would actually go out to pick up somebody. So I look at where we are now, and a lot of the paramedics and folks we have that you train, it's the next thing to a PA or physician's assistant, isn't it?
It's close. It's more the equivalent, as we say, as a nursing type license. But I think the uniqueness of this is that as paramedics, you're trained in what we call the medical model, which is where you find a problem and then you treat it, and then you pass that care on to someone else. Nurses, on the other hand, are trained in the nursing process, which is the ability to help the person through the injury and illness. So kind of two different ends of the spectrum, but both patient focused. So that's where you get the difference. The paramedic is really trained to find and treat that immediate problem that you have and get you to the next level of care. So it kind of falls a little bit short of a PA nurse practitioner type practice, but certainly more than standard first aid, okay?
So what I want to do is take a quick break, and when we come back I want to talk about that 911 call, okay, and what folks should be prepared or expect to answer when that call comes in, because from what I've heard you say and others, that's the critical juncture of information to get things right at the start. So we'll do that when we come back.
Very good.
Ladies and gentlemen, we're talking with Richard Stevenson. We're talking about summertime issues that you may be faced with personally, a child or a friend. Stay tuned. We'll be back in a moment.
You're out for an evening on the town. Finally a chance to relax and forget that you left your front door completely unlocked. Fortunately, you just installed a security system from Star Communications. With just your cell phone, you can check on your house, lock it down, light it up, and get back to relaxing.
You forgot to put Buster in his crate.
Unfortunately, we can't help with that. Security and automation from Star Communications. Call today to find out more.
Ladies and gentlemen, welcome back. Thank you for being with us today. We Should Know is on the air. We're talking with Richard Stevenson, Sampson Community College, instructor at Sampson Community College, EMS education, basic skills, instructional duties, basic and advanced EMS classes, introductory level to computer classes, life skill classes, taught at Tar Heel Challenge, Sampson Regional Medical Center, registered nurse, nursing duties, telemetry, ICU, emergency services, academic scholarship, book and certification exam reviews, understanding EKGs, firefighter 1 and 2. The list goes on and on and on. This has been your life for quite some time, Richard, and there's many times I know we've known each other for a long time, and I would look at you and say, you know, why don't you just go ahead and be a doctor and get out of this? But something tells me you enjoy this kind of contact. You enjoy the interaction of the public like this and being involved with people and helping people. So with that said, when we went to break, we wanted to talk a bit about when that first thing hits you that, well, I need somebody else, and the 911 number comes to mind, and your finger goes to the phone and you push that button and dial 911 on the other end of that phone. Tell us what happens and what you need to be prepared to let these folks know and why.
Sure. We have an E911 system in Sampson County where they actually have the ability to coach and counsel you in how to provide care for the patient over the phone. In the past, they've actually assisted a father in delivering his newborn over the phone before EMS personnel could get there. But let's not go to that extreme. Let's just talk about the basic call. Once you determine that help is needed, this is more of a situation than I need to handle at home. It's actually more of a situation than I need to load someone in my personal vehicle and try to transport them to the hospital. So I need to stay put, call 911. What do you need to be prepared to do? Give them as much information as possible. And the biggest thing is the chief complaint. Why are you calling 911? You know, giving the most accurate information allows we'll say over the phone triage and coding of the call within the CAD system so that the emergency medical dispatch software works properly. In other words, it puts the telecommunicator in the right area for your chief complaint. Let's take one that would be very noteworthy. I'm calling because my husband's having chest pain. Well, chest pain is of cardiac origin until proven otherwise. It means you really need to be seen by the paramedic and probably by the ER doctor. That puts the urgency on the call, the chief complaint does. The next thing is they're going to need some demographic information. You know, the way the system is set up in Sampson County with the phone service is everything is 911 addressing as well. So every landline that calls to the 911 center has a physical address. But you as well as I know, we live in a world of technology now where there are many households that all they have is cell phones. And so by token of that, everyone needs to realize that they've got to be able to give accurate information for the address, the phone number you're calling from, so that if you're disconnected, they can call back. But the most important thing, so they can get that physical address and get that responding unit on the way. We talked and alluded to Sampson County EMS. Sampson County is 963 square miles. And because we are an agribusiness county, we don't have as much population as we do wide open spaces. So by token of that, the EMS bases are strategically located throughout the county, which also means that there may not be someone just around the corner responding. So this is why it's even more important to give accurate information so the expediency of EMS is properly documented. But then also, you know, be aware that we have volunteer squads in the county. We still have volunteer squads that are more locally based than just the EMS bases. They too may be responding. We have fire medic units. Kevin Hare with Sampson County EMS is working on a program right now where the fire departments are being dispatched to all cardiac arrest calls as extra set of hands and with a defibrillator that we'll talk about a little bit later on. But being able to communicate to the 911 telecommunicator the chief complaint, the reason you're calling 911, a good physical address, and then if you're calm enough to be able to take some instructions from them, they're going to ask questions about the patient's condition, how are they breathing, all of these things, are they talking to you, because it helps that triage process. But then also they're going to be able to give you some instructions over the phone. Now, the one thing I would tell to you and everyone, it's okay if you're not able to follow those instructions, because let's be truthful with each other. If there is a dire emergency within your household, you may not be calm enough to do that. But you did the most important part. You called 911 and you got help on the way. And then we go from there.
And I think that moves us to that whole point that if you get to an issue and something has punctured the skin and a child or family member or a neighbor is bleeding, or you go visit somebody and you walk in the house where there's blood there and they say, well, I don't know what it is but my hand, and you don't know what to do, they still will give you some information out of that. So let's talk about those soft tissue kinds of injuries, and a lot of times it can be sports related as well.
It can be. You know, the simplest thing to remember with any type of bleeding is that it's just simple direct pressure and elevation. Apply direct pressure to the wound with preferably, if the person is able to assist you, allow them to do it, because there's always a concern about bloodborne pathogen exposure this day and time. You know, certainly, you know, probably not if it's your immediate family member, but if you're out in public and you were going to help someone,
you wouldn't know.
You wouldn't know. And so we actually emphasize doing universal precautions, which is you treat every patient with gloves if there's the risk of exposure, but the average person in the public's not going to have those gloves there. So how you still assist is, you know, you become the counselor and you help the person understand, you know, here's a towel, put pressure on your wound where you're bleeding, and if it doesn't potentially involve, you know, the remainder of the extremity, then you elevate it above the level of the heart, and continue to apply that direct pressure and allow your natural clotting process to help stop the bleeding. It's not really recommended, that people use tourniquets and things of that nature, but as a layperson, but that the direct pressure and elevation is paramount. But here's the key thing to remember. And I'm going to use a child as an instance, they come in and they've got an abrasion, and you sit them up on the countertop, and what do? We reach for a paper towel and we wet the paper towel. Mm-hmm. And let's say they've skint their knee and we put pressure on the knee, and then we take it off. Oops, it's bleeding. Okay, let's put some more pressure on it, and oops, it's bleeding. You don't do that. You put the pressure on there and you hold it and give it time to clot, which is several minutes, and then you pull it away. We actually allow it to begin the clotting process, and then we remove the compression bandage, and all we do is we pull the clotting factor away, and it just continues to bleed.
A key question when it comes to soft tissue, and you hit a good point, is that oftentimes folks will ask, well, if it's a cut, for example, maybe it's a sport, it could be, kids playing in the yard and they fall on something and they end up with a cut. Is there an indicator there that even if the bleeding stops, that the wound is such that it would need stitching or some kind of way to bring the skin back together for healing purposes, or what's your recommendations on that?
When you look at that, generally something that really did require suturing, it's going to be difficult to control the bleed. Mm-hmm. But when you look at it, you looked at the depth and the location. If it was right near a joint or where you were bending at, mm-hmm. then it's going to be very difficult to heal in that process. Once you clean the cut up and with soap and water, and then it looks to be of the depth that in your impression, oh my gosh, this may need stitches. Then if it's to the point you're asking yourself that, then you may want to get it checked out. It actually helps the healing process if it is of the depth that it needs stitches, and plus minimizes any scarring.
Should you ever apply soaps or anything of that nature as far as trying to clean the wound?
Sure. I mean, soap and water is good. A lot of people use peroxide. Peroxide actually is a debriding agent, but most of the time just soap and water, dry the wound and keep it clean, and then bandage it is sufficient for minor scrapes and cuts and things of that nature, even abrasions. But if you have a wound that is significant enough that you feel it may need stitches, you probably need to get it checked out.
A quick area I want to get into, and we got so much to cover today. I know we're not going to get to everything, but the whole issue of muscle and bone injuries, and I think more and more of sports during the summertime. I think of people swimming. I think of folks at the beach they're doing certain things with their body that they may have not done for several months or even years, and all of a sudden they end up with, well, I can't turn my head the next morning, or I tried to get up and I couldn't sit up straight, or my leg is swollen. And how do you know, and what do you recommend when we talk about those issues? Because oftentimes you look at it, and from a lay point of view, you don't know whether it's broken or not broken, or maybe you put too much pressure on it, or you just got a sore muscle.
Well, when you talk about musculoskeletal injuries, I tease people, especially as we begin to reach middle age and beyond, that sometimes those aches and pains you're having, you need to go see your family doctor and get your AGE levels checked. And they go to write that down, and then they realize AGE is your age. What you just described is people that get into physical activities during the summer and even the winter months that are more engaging than they're normally accustomed to. They do get aches and pains. But what you need to be concerned about is what happens when you have a slip, trip, and a fall. Okay? If you have a slip, trip, and a fall, and there is a reason that you may have injured yourself, then certainly, with rest, ice, and elevation, if that's not giving you some relief, then you probably want to be evaluated. We'll talk more about that in just a moment.
Absolutely. We're going to go to another break, and we'll be back in a moment. Ladies and gentlemen, we're talking with Richard Stevenson. We're talking about issues that you may have faced or maybe will be facing this summer. Call a friend, stay with us, and when we come back, we're going to talk about nosebleeds. We'll be back in one moment. Stay tuned.
Whether it's video, voice, internet, or cellular, Star Communications connects you to the things you love. It's what we do and have done for over 50 years. Star Communications, your local technology company.
Ladies and gentlemen, welcome back. I want to thank all those folks at the radio station that mentions our show and keeps folks informed about who we have coming on during the week. And that would be the morning crew with Nolan, Nolan Z, and also the L-Man, and we talked to Grandpa in the morning down there, and we appreciate all their commentary, Wayne Weeks. And lunchtime, and of course Nicole that introduces this show each and every week, and Tommy the Fly in the afternoon. Boogie Shoes Radio Network on Saturday afternoon. I think I've covered everybody. We appreciate your commentary. We're talking about injuries, particularly summertime injuries. We're talking with Richard Stevenson. Richard, along with your experience with teaching and working in the field of medicine, the associations and organizations you're involved with is numerous, to include the North Carolina Department of Insurance, Fire Marshal, school director there, level 1 and 2 with the North Carolina Office of Emergency Medical Services, North Carolina Department of Justice Training and Standards Commission instructor in that area, North Carolina Association of Rescue Squads, Sam's Community College Crisis Management Team, Social Media and Web Services Committee, Distance Learning, Safety, it goes on and on, Emergency Medical Services Degree Program Chair. The list continues. One I did not see on here, which is very important, is co-chair of the Local Emergency Planning Committee, which works directly with the Director of Emergency Management here in the county and helping make policy. So you're a busy guy, and also married and got a beautiful daughter, Sophie, that we both know very well, because I usually see her once a day. So listen, thanks for being with us. Before we go into those injuries of the eye, nosebleeds, and that kind of thing, let's back up and just for a moment talk about the fall situation, because you know, whether you're young or old, if you're on a ladder, or if you, like I have in the past, made the wrong decision and try to stand on top of a step ladder, which is never a good decision, right. You can not only incur injuries, but you could incur long-term injuries.
Absolutely. That was one of the things I wanted to go back and touch on. During this season, people are out working in their yards. You alluded on break, you know, cleaning your gutters, things that would appear perfectly harmless in doing, but they result in an accident. That's why they call it an accident. Anytime you fall from a height, and that height can be, you know, greater than 2 to 3 feet, depending on what you fall on, you can injure yourself. So we wanted to make sure that people realize if you fall and you hit your head, and you know, you become dizzy, lose consciousness, things of this nature, you know, concussions has been a big thing in the media over the past few years. We need to be aware of that, but we also need to be aware that if any fall results in an extremity injury, in other words, you have difficulty moving your arm, moving your leg, let's get it checked out. If you fall from a height off of a ladder and there's the potential for a person injuring their back, spine, or their neck, remember this: keep the person calm and keep them stationary. Keep them lying down, call 911, let them come out and let's get things checked out. Because that is a critical impasse, is that you maintain this inline stabilization, which you can do by just staying right with the patient, have them remain calm and still. But we have to be cognizant of these types of falls, because they are very prevalent, especially during this most active time of the year.
And the falling situation too, and you talked about that, I guess is one of the hardest things to do, is to keep people, as long as there's not anything else that is about to be problematic for them, is keep them there until professional help can get there, because they could injure themselves even more.
Correct.
Or in some cases probably could be deadly if they're moved.
Sure, and that is why when you go through formal training as a first aid provider, even an extremity injury, let's say that you feel like you've broken your wrist, you feel like maybe you've broken the bones in your arm, then we don't put as much emphasis on being able to splint that as we mean stabilize it. You know, you've often heard, and you alluded to in our pre-conference, that you see on TV all the time, they're splinting it
Absolutely.
up. And that was the old school of thought. And trained personnel, yes, they're going to split, but for the untrained person, what people need to realize is, If you allow it to remain in place and seek medical help, you do no further damage. But if you have broken bones and especially jagged breaks in the bone, and then you attempt to splint it, reposition it, anything like that, you may actually damage nerves and blood vessels that are underneath the skin that you're not even aware of. So it's best not to splint. It's best to, if it's a potential back or neck injury, call 911, and then let the professionals do the stabilization, splinting as necessary, and then get you to medical help.
Safety first and engage the system.
That's right. Let the system work for you.
Absolutely.
That's right.
I want to talk a bit about this whole issue of injuries with eyes. Could be anything from a bug getting in your eye riding a bicycle, to a nosebleed, or to even a trauma, impact trauma, and you injure a tooth. One big thing I've noticed a lot with younger children, and I mean occasionally I even have that right on, is nosebleeds, and sometimes it looks like, oh my gracious, especially if you wake up and your nose was bleeding and it's on a pillow, or it's your child and you walk in there and it's like, wow, what do I do? What is the correct procedure? Because there's several different stories out there about compression, how you press the nose, you push something up it or you don't. Tell us what the real requirement should be on that.
You know, there's many urban legends of what you do, but the actual intervention is quite simple. One of the urban legends my mom employed as a child, and I can remember it, is to place scissors between your shoulder blades, because back in that day they were metal scissors, so they were cold, and the cold actually caused a little, constriction in the blood vessels of your nose. But don't do that. The simplest thing to do is to just pinch the nostrils and lean the person forward, child or adult. By compressing the nostrils and leaning them forward, it doesn't allow any of the nasal blood flow to go into the throat and possibly then compromise your airway and make a person nauseated. So pinch the nostrils and lean them forward, hold it for a few minutes, and it should clot off. If after several attempts it doesn't, then that's more than I can handle at home, so we need to get this checked out. I think with kids and everything, the big popular thing with children is still, kickball, dodgeball.
Yes.
They throw a ball, hit you in the nose, it hits you just right, you have a nosebleed. A very simple thing to fix, a lot of consolation to the child, but pinching the nostril, lean them forward should help it. The other thing you alluded to is, what if something gets in your eyes? Well, it can be anything from dust, dirt, grime. If you're riding a bike and a bug flies in your eye, the biggest thing is to irrigate the eye, and the most important thing is to irrigate the eye away from the unaffected. So let's say that you just have this eye is the one that's bothering you. Well, let's say that it's sand, grit, grime, anything like that. If you were to turn the head towards the good eye and irrigate it with water, you're just washing the dirt out of one eye, washing it into the other. So just always remember irrigation for up to 20 minutes if you have something in the eye, but always irrigate away from the unaffected eye. If both eyes are involved, then obviously you would irrigate both.
One of the things with eyes that often comes up too, especially during the summertime in yards and lawns and so forth, or even on porches, folks will be spraying insect repellents, or maybe it's a wasp nest or something of that nature, and the wind catches it and in your face. That's automatically a trauma, because you're thinking, oh my God. Or it could be you're spraying some kind of chemical to kill weeds, and boom, you get the wind in the wrong space. What do you recommend with that?
Same thing as we talked about before, soap and water to wash the exterior, then irrigate the eye or eyes and get it away from the unaffected eye.
I think for the novice out there, for somebody unlike yourself that deals with this on a daily basis and teaches people what to do, it's a pretty horrific feeling, because you feel a need for that emergency, but then you're like, well, I don't know whether I need to. We'll just get somebody in a car, and then the other part of the unsafe driving somebody to the hospital, if it's a family member, the family member is already kind of in a panic mode. So you're trying to drive somebody, and then as my friends with Highway Patrol, Jeff Gordon and others would say, you know, you don't need somebody driving that is, you know, psychologically not capable of driving. So that's another reason to dial 911 if you think that's necessary.
It is. There have been documented cases where the person chose to try and transport a person to the hospital and their condition deteriorated. And then you could potentially be somewhere it's hard to give them directions on where you're at. And so then it delays EMS from arriving at your location. Sometimes it's better to stay put, call 911, and you know, if you don't know how to do or can't intervene, just reassure the person by telling them the truth. I've called 911, help's on the way, and try to remain calm yourself. And then that will keep their anxiety levels down. But that is what you do. You just let them know what you've done and are doing for them. And just always remember, we don't hold the answers. So, you know, you never want to use a phrase that people unfortunately do like to use in emergencies. JW, don't worry, everything's going to be okay. We don't control that. Right. But what we do control is everything that we're doing for the person. Mm-hmm. So you remind them of that, because that is reassuring to know that help is on the way and that you are there to help them at whatever level you can until the more advanced help arrives. And
that could be anybody from a family member or to somebody passing by the road, depending on where the accident is. If you're hiking or you're walking on a trail or whatever it may be, to your point of location becomes so critical. So I guess one of the things would be is to be able to let folks know where you are with your communication device, because it's it's sometimes the only link you've got to the public. And as you mentioned, not only is this county huge, but the big portion of it is very rural, and accessibility is critical. We're going to take another break. When we come back, I want us to talk about an issue that I know you've taught some on, and a lot of your folks that go on these emergency calls are preparing for, and that's this upcoming week with fireworks and the celebration of the 4th of July. Okay. So let's talk about that when we come back. Ladies and gentlemen, we'll be back in a moment. We're talking with Richard Stevenson. Call a friend. Stay tuned. Might be something in here that saved your life or helped save a life. Friends alive. Thank you. Be right back.
Give me a home where no burglar can roam, where my kids and their pets safely play. With security by Star, I can check in from afar, hit the lights, lock the door, night or day.
Really? Yeah. I can see my cameras, switch the lights, lock the doors, set the alarm, all from my phone.
Their prices are right. My home's locked up tight. Star Security makes me feel great.
Ladies and gentlemen, welcome back. I want to thank you for being with us today. We've had a lot to pack into a short period of time when it comes to talking about injuries and accidents and how you should react. We're talking with Richard Stevenson, of which we have explained is an instructor at Sam's Community College since 2002, a member of a number of organizations, instructor in a number of areas. Some of the organizations and associations, I'm just going to mention a few of these: the American Heart Association, Regional Faculty, BLS, Basic Life Support, American Heart Association, Regional Faculty, and ACLS and PALS. All of these things are important, Richard, for folks to understand that when we're talking about these subjects, you're not a novice when it comes to this. You have most likely either seen it, had your hands on it, or been involved in it in some way, and it's not all been classroom. So I want to come back from this break and go particularly to something that's coming up, this July 4th celebration. The fireworks tents are up. They're every Walmart store lot, seem like you see these tents. They sell various kinds of fireworks. Oftentimes, according to data, emergency rooms see a huge uptick in injuries as it relates to burns specifically related to some of these fireworks injuries. What should we know and how should we treat those?
The biggest thing is safety is paramount. I mean, adult supervision and even supervision of the adults when they're employing fireworks at any occasion. The big thing about fireworks that concerns us is the possibility for explosion, actual penetration because of the rocketing action of fireworks, as well as the direct burn from the firework itself. When it comes to burns, you know, the things we see most often is first-degree burns, which is just a reddening of the skin. Obviously, you want to remove the burning process, which is, you know, cool water wash. The burn becomes worse. It's a second degree, which is when it blisters. The most important thing to know about second degree burns, they're very painful, because obviously you have burnt your skin enough that it has blistered and pulled water from the sublayer of skin. But the key thing is to try and keep the blister intact. I tell people it's so simple. You know, your skin keeps the good stuff in and the bad stuff out. So with a burn, the biggest risk of complications from a burn is infection. So as long as we can keep that skin intact and then allow that blister to resolve, it minimizes the risk of infection. But once again, you know, all you can do is wash it, soap and water, cool the burning process. You know, reluctant to apply salves and lotions and everything, cover it with a clean dressing and allow it to heal. Depending upon the amount of area that is burned, you may need medical attention. We're talking about just simple burns, you know, to the hands and the fingers, you know, from fireworks. But, you know, there's all sorts of burns out there. People cooking out, using charcoal lighter fluid, things of this nature. If you have any burns that involve more than just a small area of skin, it needs medical attention to minimize the risk of infection.
And oftentimes I hear folks, now you know you have as well, will say, well, I should have known better, or, you know, I thought about this might not be a good choice to make at this time. So I guess one of the things is to think through what you're about to do.
Absolutely, absolutely.
And that process is critical when it comes to these explosive devices. And there's so many of them, and you don't really know what you're getting a hold of. There's a lot of devices, I'm told, that sold in other states, and people drive there to get them. There's just something about this boom sound and sparkling sound on July 4th. Absolutely. And celebrating our independence.
The responsibility is something that's paramount. I mean, you have to be responsible and realize that there is a degree of unsafe outcomes that come from this, and so be prudent in it.
The other area, and I would also say with that, again, to a lot of friends that's in law enforcement, with Highway Patrol and others, during this weekend, also don't drink and drive. Not only Absolutely. Don't text and drive, but if you're going to consume alcohol or any impairing substance, do not get behind the wheel of a car. And I shout out to all those people that's going to be out there to make sure that you and I and others are safe, and our children and our loved ones are safe. We give them a big shout out as well. So let's talk about a bit the other area that's a huge part of the summer environment, and that's every kind of bug, bite, critter, snake, whatever. Right. And again, sometimes, as we talked about a while ago, that swelling, you don't know whether it's some kind of poisonous spider, or is it some kind of wasp that you're allergic to, or you may not be allergic. But sure. What do we do? What do we look for?
Well, let's talk about snake bites. Okay. You know, we have several poisonous snakes indigenous to this area, and the one thing that people need to know is that 50% of all poisonous snake bites are non-venomous. They're dry bites. The poisonous snakes do not bite humans by design to inject poison. A lot of times it's a defensive strike. Mm-hmm. I didn't participate in that study to prove that, but, yeah. but we do know that to be a fact. But the difference between a poisonous snake bite and a non-poisonous snake bite, poisonous snakes have fangs. So therefore you're generally going to have 1 or 2 perforations into the skin. It's going to be very painful, soft tissue swelling around the immediate area. Does need medical attention, bottom line, okay? All of these things you may have heard and seen over the years, medical attention.
No matter what the cowboys and westerns
That's
did on
right.
TV,
That's
forget
right.
all that.
We're going to forget all that and seek medical attention. If possible, to identify the snake safely, sure, that helps out. But generally, you know, antivenoms do not come into play with the types of poisonous snakes that we see in our area. The one that produces the larger pain and complications is actually a copperhead bite. They're very aggressive snakes. The other thing is non-poisonous snakes have teeth. So if you get bit by a non-poisonous snake, you almost see a half moon type of bite that's just red and maybe a little aggravated at the side of the bite, but nothing like the perforation of a poisonous snake bite. The other thing you alluded to was flying insects. Flying insects, and we're going to add the fire ants to this. Absolutely. For a long time, you have people that tell you they're allergic to bee stings. Well, that allergy is known as anaphylaxis, and it actually is a severe life-threatening reaction to the bite or sting of a flying insect or even a fire ant now. So generally people know that, and they carry an EpiPen with them, which is just an auto-injector device that they're able to self-administer medication in the event they were exposed to a flying insect or a fire ant. That is generally a reaction that occurs very quickly when that happens. Could it happen to someone that has never been diagnosed with that before? Yes. If you get stung by a flying insect or getting bit by a fire ant and you begin having respiratory problems, seek medical help immediately. Okay? The other thing is that, especially with the summer, that concerns people is heat exhaustion and a heat stroke. Okay? We want to make sure we get that in.
Absolutely.
When a person goes through heat exhaustion, they are sweating profusely because their body is actually trying to cool them down. But then the body realizes that you've been exposed to the heat so much now that we can't actually make it work. And then all of a sudden you stop sweating. Now, a person that realizes they're experiencing heat exhaustion, they may become dizzy. Notice that they're profusely sweating. What they need to do is be removed from the heat. Get out of direct sunlight, get in the shade, get some type of rehydration. And sometimes we need to revert back to that good old beverage called water, not a soda drink or anything like that. Something like Gatorade or Powerade, something that replenishes your electrolytes, but at least water. If you get to the point that you've got the dizziness, the headache, the blurred vision, and you realize that I've been sweating so bad, but now I'm not sweating anymore, that is the possibility of a heat stroke.
Wow.
The intervention there is to cool the person down immediately at all costs and seek medical attention.
911.
911, that's right. That is right.
We've covered a significant amount of items. We did not get through everything we wanted to talk about. We're kind of coming to a close. For those folks that want or would like to have more information, or if they're interested in getting involved in a CPR class or a first aid class, tell us how they reach you or reach somebody at the community college.
Sure. We've been working with a community outreach program to the church community to offer CPR, in the churches. A lot of churches in Sampson County are buying AEDs now, so they're having everything. But you can reach us at the college at 592-8081. You can speak to myself or Carol Watson to assist you in that. Or if you just have the need for a CPR and a first aid course for lay personnel, give us a call and let us see what we can do to work that out for you. We offer CPR classes monthly at the college, but if you need something on site, we'll be glad to do that.
And the population that we're in now, statistically, we've known this obviously for a long time, but it is becoming more heavily concentrated with older citizens, and these things, when you talk about stroke, cardiovascular issues, heat issues, and those kinds of things, statistically you're more apt to see those kinds of things.
Sure.
So I think it's important to encourage people to call, again, 910-592-8081, ask for Richard Stevenson or Carol Watson and schedule that class. I think it's amazing you're doing that at churches.
We are. It's been a tremendous response. And the one thing we will add to this, a person's best chance of surviving a critical incident outside of a medical facility is the person that's with them when the incident occurs. And that person may not be medically trained. It's gaining access to 911, early access to 911, early EMS care, then early advanced care for that person is the key to good outcomes.
Well, again, thank you for being with us, taking time out of your extremely busy schedule, and we appreciate what you do and all of our emergency responders in Sampson County, and we wish everybody the best. Ladies and gentlemen, we've been talking with Richard Stevenson. We've been talking about issues that may be similar problematic issues for you. We hope you enjoyed the show today. We look forward to your continued comments. And as always, we say, may God bless, and we'll see you again next week on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.